Hello everyone. Today, we're delving into the world of a medication called Cosentyx, commonly known by its generic name, secukinumab, as well as its brand name. As always, this discussion is meant for educational purposes. If you have health-related questions or concerns, please don't hesitate to reach out to a medical professional. Description: Cosentyx, with its active ingredient secukinumab, is a medication that falls under the category of biologics. It's specifically classified as an interleukin-17A, IL-17A, inhibitor. Cosentyx is primarily prescribed to treat various inflammatory conditions, particularly those associated with autoimmune diseases. It was initially approved by the FDA in 2015. One of the primary uses of Cosentyx is in the treatment of moderate to severe plaque psoriasis in adults and children aged 6 years and older who may benefit from systemic therapy or phototherapy. It can also help manage psoriatic arthritis in adults, which is a condition that affects the joints and is often associated with psoriasis. Additionally, Cosentyx is indicated for the treatment of ankylosing spondylitis, a type of arthritis that primarily affects the spine, as well as non-radiographic axial spondyloarthritis, which is another form of inflammatory arthritis. Cosentyx works by targeting and inhibiting specific proteins in the immune system responsible for causing inflammation, thus providing relief to individuals suffering from these conditions. It's typically administered as an injection. Warnings: before considering Cosentyx, it's essential to be aware of certain precautions. It's not suitable for individuals with a known history of hypersensitivity to secukinumab or any of its components. Furthermore, it should not be used if you have active tuberculosis, TB, or other severe infections. Before starting Cosentyx, your healthcare provider will assess your risk of TB and may perform tests to rule out TB infection. It's crucial to discuss any recent or ongoing infections with your doctor before starting Cosentyx, as it may increase the risk of infections. Additionally, if you have a history of inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis, inform your healthcare provider, as Cosentyx may exacerbate these conditions. Before taking this medication. Before initiating Cosentyx, several factors need to be considered. It's essential to inform your healthcare provider about any allergies or hypersensitivities you may have, as well as any ongoing medical conditions, especially infections and gastrointestinal issues. Your doctor should be aware of your vaccination history, as some vaccines may need to be administered before starting Cosentyx. If you are pregnant, planning a pregnancy, or breastfeeding, discuss the risks and benefits of Cosentyx with your healthcare provider. Side effects: as with any medication, Cosentyx may cause side effects. Common side effects may include upper respiratory tract infections, diarrhea, and reactions at the injection site, such as redness or itching. These side effects are usually mild to moderate in severity. In some cases, Cosentyx may increase the risk of serious infections, including fungal infections, bacterial infections, and tuberculosis. It can also lead to allergic reactions, which may manifest as rash, swelling, or difficulty breathing. If you experience any of these symptoms, seek medical attention immediately. Interactions: Cosentyx may interact with other medications or vaccines. Be sure to inform your doctor about all medications, supplements, and vaccines you are currently taking or plan to take while on Cosentyx. Dosage: the correct dosage of Cosentyx is crucial for its effectiveness. Always follow your doctor's recommendations regarding the dosage and administration of this medication. Typically, Cosentyx is administered as an injection, and the dosing frequency and amount can vary depending on the condition being treated. Your healthcare provider will determine the most suitable dosage for your specific case. Avoid: while on Cosentyx, it's important to stay vigilant about potential infections. Be cautious about any signs of infection and report them promptly to your healthcare provider. Additionally, it's advisable to avoid receiving live vaccines during Cosentyx treatment. FAQ: you may wonder about the age restrictions for Cosentyx. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that concludes our overview of Cosentyx, also known as secukinumab. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.